Having courageous conversations, but also having the courage to do things differently is something that really does set CMHA apart.
It's great to grow, it's great to bring revenue in, it's great to do all those things, but the core of what we are here to do is to improve the life and well-being of the members of the community.
When CMHA first was incorporated, it was incorporated as a consortium mental health center in the late 70s. It didn't provide any direct services. In 1981, maybe 82, the executive director of CMHA convinced the affiliates that CMHA could provide direct services. That started a very aggressive pattern of growth, 1980s through 1990s, where CMHA eventually became a freestanding organization, began to provide residential services, vocational rehabilitation, social rehab, case management, in-home supervision programs, and eventually outpatient services as well.
CMHA has grown in a lot of ways. I would say everything from interdepartmental teamwork and cross-collaboration to advances in technology with our electronic health record. I think we've evolved with creative thinking, being able to kind of pivot when we have challenges head our way.
I've been here for over 20 years. I've seen CMHA kind of move through various phases. We spent a lot of time focusing on our foundation and building this solid sense of community.
We've expanded our programming, we've added on new staff to our agency, and we've also, I think, have changed our way of thinking, right? We are no longer kind of stuck in this traditional way of how we serve people and provide behavioral health services. We're constantly paying attention to our community and thinking about, like, how can we serve this family better? How can we serve this individual better?
Gone are the days of like 2 decades ago where we would work in silos, and now I think we put real intentional thought into what heads we bring to the table, and it being like a cross section of the agency, whether it's going after certain grants or initiatives or going after different gaps in care that we have. When we do that and we have that crossover, I think it behooves the clients that we serve. We can maximize the resources and supports that we throw at them to make them as successful as possible in their change.
The social club really sprang from a one afternoon, one evening a week program that was called the Welcome Inn. Eventually it evolved into a full-time psychosocial rehab program. It moved around quite a bit at CMHA until we were able to secure the funding to build the Team Time Club on Russell Street. The members had been so patient for so many years, waiting for their own space. And they not only got their own space, they actually worked with the architectural firm to design the space. It's probably one of the projects that I'm most proud of and most pleased of.
It's been wonderful for the clients to have a safe space to come over and then not to talk about medical stuff or anything like that. Come over and chill and relax.
Securing 233 Main Street, moving to downtown New Britain was a huge event. We came downtown and we became really, really good neighbors and good citizens. We were also the only downtown entity that brought lower level retail to downtown New Britain.
Starting from a small building and this here where we are right now at Main Street building, it's huge, having the space for, the employees and the clients to work. That's like a huge accomplishment.
When you are under one facility, one building, it's much easier to create synergy. And that's what happened when we moved many of our programs into one location. There's a lot more collaboration. And when there's collaboration, that means that our clients are being cared for.
Kensington Garden was 10 years in the making. We found a convalescent home that in the middle of the COVID pandemic was going out of business. We made them an offer and were able to secure the property. It took us about 14 months. It was a complete gutting and rehabilitation job. The clients moved into it about 3 years ago, and it has been an overwhelming success. Many of these people that are at Kensington Garden have been with CMHA for well up to 20 years. There are no other options for them. To see them now react to having their own space, their own private bedroom, which they did not have before, the grounds that they have, the support services that are there, it makes all the difference in the world to them. It makes all the difference in the world to us.
CMHA is a company that is innovative. We are community involved. We are always thinking how we are going to not only better ourselves as a company, but better the community.
CMHA has been a positive layer for individuals, nonprofits, school district, because we are able to have a better understanding of mental health, trauma, behavioral health because of our working relationships.
A major part of my job is to make sure that the clients, the people who walk through these doors looking for services, have the best, highest quality services we could provide, that they have a great experience, that they too feel like a part of the CMHA family.
For many of our clients in this agency, it's home. You can do all the interventions in the world, resources and support, but if you don't have that foundation of that relationship with them, none of the rest really matters.
I absolutely love the positivity and the passion that we all serve. We have one main goal to serve our clients, and we all have this one purpose. It's like one big family trying to accomplish the same goal.
Every organization wants to have a culture of caring. We just don't say that, we actually do that. Our employees, they just don't believe in the mission, they really believe in each other. That's kind of what you strive for, is a culture where employees really have each other's back. You have employees that just jump right in to make sure that the needs of the client are being met in that moment. But what's really exciting and profound to see is that we have another group of employees that come in to support those employees. It's really about people caring for each other and not just caring for the clients, but caring for one another.
I think our culture is unique. Even though we have gotten larger, we still have this kind of family-like culture and atmosphere. We do really, really hard work, and I think as an organization, we also try to let our staff know to have fun too. People really cover for each other, they support each other, they're there for each other. I think that kind of makes it unique. For the next 50 years, I see CMHA really outreaching beyond our region. I see us being a community partner to more communities, and I see us really kind of taking our services and our expertise to beyond the whole state, not just our region.
I want us to be the agency, the organization that people feel extremely comfortable with walking in the doors and knowing that even if it's not them, that their family members will also be treated with exceptional high quality care.
I think the future is very exciting. So it really is about having an innovative culture, making sure that our leaders feel that they have the tools that they need to support their staff. We have a lot of well-rounded employees that are very engaged. They're also thoughtful. They're feeling comfortable to voice their opinions. They're feeling comfortable to share what they think, the direction that CMHA should go in the best interest to serve our mission, but also to serve our clients.
I think it's really important for the organization to prioritize community collaboration and having conversation with community partners and the clients in the community to be able to really figure out kind of where are the gaps in service and where are the areas that require expansion so that we can make sure that we're meeting the needs of the community that we serve.
I think CMHA has a lot of opportunities when it comes to looking at diversifying, besides the funding streams, but also diversifying the population of people we see. We have an opportunity to reach more children and families. We definitely have to continue looking at data. We have to continue to look at our community partners to really look at community needs and do needs assessments. And I think if we utilize that data, it's going to make us more innovative and more strategic.
I think everybody that works with individuals, families, and students needs to make sure that they are in partnership with community mental health affiliates.
I think we have to be fierce. We have to not be afraid to take a calculated risk. My expectation would be that the growth that we've had over the last 50 years is just going to continue, like exponentially.